there's a difference between like knowing the pattern and having connected the dots or made sense of things,
Mm,
which is
mhm,
what talk therapy is so good at doing.
mhm.
There's a difference between that and actually feeling and connecting with your body and experiencing the emotionality behind it. Those are two very separate things that can happen within talk therapy and somatic work.
Welcome to the Wealth Podcast, Off With Your Coat, a podcast on women's health and wellness where we flip the script and ditch the surface level chatter. We need to ask the real questions. Let's get back to storytelling and back to basics to help us uncover how to set ourselves up for true health and wellness and pass it on. I'm Kat Duff, founder of GenWell, the women's health advocacy brand building wealth, the intersection of health and wellness. Some days it's me and a doctor, coat off, talking about what really matters. No fluff, no filters. Other days, it's East meets West, trading tools, not punches, to help move women's health forward. We're building generational wealth. Come with us. Coats off, let's go. Guys, we have a super exciting podcast today covering somatic therapy with Emily Powell and Catherine Hidalgo White, and we are diving into bodies. I mean, we do not know anything about our bodies. We were never taught about any of that. And we're going to go into some amazing conversations with two extraordinary women. So, Emily and Catherine, I'll let you take it away with some intros.
Yeah, I can go first. Thank you for having us. We're so
Of
excited.
course.
I'm Emily. I'm a licensed mental health counselor in Massachusetts and Pennsylvania. And I have a group practice specializing in relational and attachment trauma. And we specialize in using bottom up somatic therapies like parts work and internal family systems to help folks get to like the root of how they're feeling rather than just mask the problem itself.
Awesome. Catherine, you're up.
Hi, I'm Catherine. I'm a licensed professional counselor in Pennsylvania. I am trained in brain spotting and dance and movement therapy. Um, I'm also a certified clinical trauma professional. I am a huge believer in mind-body connection when it comes to the therapeutic process, and I'm really excited to talk about it more.
I love it. I was gearing up for the podcast today and I was, you know, just prepping and trying to take inventory of my body. And I was like, it all feels stuck. So I'm excited to figure out where we can begin.
Mhm.
So, off with your coat means you're taking off your white coat. You're sort of leaving your credentials at the door and speaking from your female experience to start. And so, I wanted to kick off by asking you guys about one health challenge or experience that you've had that surprised you as a woman.
Sure, I can
Yeah.
dive in there. One thing that was very surprising was, let's see, about in 2017, I was diagnosed with Hashimoto's, which was also, I also had my hypothyroidism, and Hashimoto's is an autoimmune disease where basically my thyroid was attacking itself. This was something that I went to the doctor for, and they said, here you go, here's some medicine, and that's that. They gave me absolutely no understanding of what an autoimmune disease is, why it happened,
Mhm.
um, and what to do about it. And I have had to be my own biggest advocate and researcher since then on how to heal and put my Hashimoto's into remission. That was a big surprise and not something I was expecting. But as I went through my own somatic therapy, I realized it was probably dormant for a long time prior to the onset of having the actual diagnosis.
Wow. What was the one thing from your somatic therapy training that led you to that sort of connection?
Well, I'm thinking of all of the therapy sessions I had with my therapist where we went back to a lot deeper processing using our body, using the idea that trauma is stored in our body and that triggers and trauma come back as a reaction and not a memory,
Right.
and diving deeper into that and understanding how my nervous system works, I was really able to understand the trauma that I was still holding on to, particularly around not really having a voice in certain situations growing up.
Mm,
And autoimmune diseases, particularly Hashimoto's, it's around your thyroid, it's right by your throat. And that has a really strong connection to not feeling like you had a voice in certain
yeah.
times in your life. Um, and I've really been able to work through that and experience what it all means, how to create connections and patterns, and um, how I can really heal myself today.
Yeah. I have the chills. That is so profound. Just thinking, especially with autoimmune disease, and I think it's 90% of autoimmune disease is women.
Mhm.
So not having a voice, I
Mhm.
mean, hi, here
Mhm.
we are.
Yeah.
Yeah.
This is where we're fighting to get answers, to get more research, to sort of move forward. And it's like the very thing that's keeping us sick.
Yeah.
100%.
Wow.
Yeah.
Thank you for sharing that. Is
Yeah.
there one last question about that? Is how you were saying that it was really hard to navigate and they were just sort of tossing you medicine,
Mhm.
right? Maybe synthetic hormones.
Mhm.
How did you navigate that space and find sort of alternative support?
I think one of the most important things was I really had to take myself seriously and turn inward and really keep track of what are my symptoms? How am I feeling? And advocate for myself that this is really difficult to navigate. And I'm not going to
Mhm.
take no for an answer when it comes to someone saying, oh, it's just your anxiety. Oh, it's
Yeah.
just, you're just tired. That's because you're busy, right? No,
Right.
there was a lot
Right.
more going on to that.
Mhm.
Mhm.
So being your biggest advocate and really honoring and accepting your symptoms, especially as something as precarious and difficult as an autoimmune disease, because it's an invisible illness
Mhm.
and it's a chronic illness for
Mhm.
most people that suffer from it.
Yeah.
Um, so, yeah, I would say that really turning inward and honoring and accepting your symptoms as your baseline and not taking no for an answer. You only
Mhm.
have one life to live. You want to live it to your fullest.
100%. We're a no fucking thank you for the gaslighting. So I totally hear that, and I'm glad to hear that you've navigated so well. Um, Emily, I'd love to ask you the same question. What's one
Yeah.
health challenge or experience that you had that surprised you?
Yeah. So I also grew up a dancer like you too. uh, and I dealt with a lot of chronic pain that I didn't realize wasn't normal. So I went on point shoes as a ballerina very early, and
Mhm.
I have like an anatomical issue in my feet. And so I thought that it was just the point shoes and not an actual issue, but I was in, like, a significant amount of pain growing up kind of all throughout my dancing years, and I learned to essentially disconnect from my body like a lot of women do, um,
Mhm.
and learned to kind of, like, if I wanted to excel in dance and if I wanted to keep moving forward, I had to kind of, yeah, totally, like, detach from the pain that I was experiencing, but
Mhm.
at the same time, I was seeking out help with some of it to mitigate it. And as a kid and like a young teen, I experienced a lot of medical gaslighting, all the things
Mhm.
of like, how real is this? And it's just point shoes. And, if you want to stop the pain, then stop point, which I know sounds logical, but is very difficult as a dancer.
I
So
get
I think
that.
yeah, a lot of my experience in terms of navigating the chronic pain has been coming back in touch with my body, which I've done through therapy and learning that it's safe to connect with my body, and listen to it and trust it. And as a result, I did stop point specifically, and that was a hard hit, but,
Mhm.
um, it was necessary. Like, it's what I've now been able to understand what, like, healthy movement feels like in my
Mhm.
body, which is
Mhm.
really liberating. But I guess that's kind of also where my experience with, like, non-Western medicine came in as well, because I tried so many different approaches to help with the pain, and the thing that was most helpful was not, like, the surgeries or the cortisone shots, but more so the acupuncture and getting into yoga and finding movement that really aligns with me and all of that.
Yeah. So you think those modalities helped you to learn more about your body and where that pain was coming from?
Yeah, and, like, actually connect to the root of it so that I could have long-term sustainable change rather than just, like, a quick fix or, taking a lot of pain medication or getting a surgery or whatnot.
Yeah. How long were you dancing before you were able to find those or find that relief?
8 years,
Yeah.
probably 10 years. Yeah.
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 I mean, and that's not just for that, but, like, in general, that's, like, the length of diagnosis for women. If
Yeah.
it's endometriosis, if it is PCOS, if it's, you
Mhm.
know, anything from soup to nuts about our health, it takes so long to diagnose. Do you have any guidance or feedback? So maybe young moms that are raising their daughters now who are in dance or they're doing things where they're trying to facilitate more conversation with them about their body. Is there anything from your experience that you would say to young moms as sort of like you know, a little bit of advice on how to get them to understand their bodies?
Yeah, I think dance really encourages a disconnection in a lot of ways. Like I have
Mhm,
a love-hate relationship with my past as a dancer because,
mhm,
it encourages a lot of like perfectionism and negative body image and all of that. So I think
mhm.
just and it's amazing, and it was, like, such a huge part of my life and my upbringing, so I think for young
Yeah.
moms with kids that are going into dance, just making sure that they are aware of the more negative side of things, and
Mhm,
staying
mhm.
on top of it, and listen to what your kids are saying in terms of how they're feeling. Like, kids are
Mhm.
so intuitive and know really well what's going on with their body until they're taught to disconnect from their bodies, so
Yeah.
I think, unfortunately, like, I have a very loving mom, and she did dismiss my pain because she just didn't know how bad it was, and
Mhm,
so a lot of the work that I've also done in therapy and IFS therapy is, like, revisiting that young dancer version of me and
mhm.
acknowledging that the pain was there and that I did need somebody to step in at the time and whatnot.
Yeah.
So,
That is exactly what we're trying to do at Genwell is build generational wealth for women, and it is as we're sort of looking back, we need to look backward to look forward, and looking at previous generations, like, our parents were taught to just like, dismiss a lot of the
yeah.
symptoms, and, to Catherine's point earlier, not having a voice, and I feel like from the parenting perspective and what's out there right now on social media and the voices in the space, they're very much like gentle parenting, but like kids also need boundaries. And so we're kind of in this space. I'm an elder millennial mom, and so I'm trying to figure out where that safe place is where you have boundaries, but you're also listening and trusting your child so that they can have healthy relationships with their bodies and their minds, as they go along and they can be in touch with their emotions.
Mhm.
Um, so I think this is a great segue to kind of how both of your lived experience has shaped your career and why you chose the specific modalities in somatic therapy that you did. So I'd love to dive in there. Um, Catherine, if you want to start.
Yeah, absolutely. I feel like my lived experience, both as a previous dancer and still someone who loves to dance, who experienced similar things in difficulty body image. There's a reality of perfectionism that is unattainable and
Hmm.
unrealistic. And having, a autoimmune disease that is very much linked to this cultural idea that you have to put other people's emotional needs before your own, that there's a sense of people pleasing and this idea that you have to repress healthy anger, that you can't disappoint anyone. And a lot of those points are from Dr. Gabor Mate, who
Hmm.
really is a trauma expert and dives into a lot of reasons why women tend to develop chronic illness more than men. And he really does identify it that it's a cultural issue, not a gender issue, which I find
Mm,
really important, especially how we um, idealize Western medicine.
mhm,
And we forget that there's so much of a gap, especially for women. So, with my lived experience, I feel like I am able to see and hear and hold space for my particularly female clients who are also maybe going through a certain chronic illness or perimenopause or menopause when they have no support.
mhm,
And there is so much I can do by knowing and having my own healed and continually healing my own lived experience without disclosing my story to my clients. But I can provide like a felt sense of I hear you, I see you, I know how hard this is, and I'm
mhm,
here with you to go back in time and create new neural pathways where healing is
mhm.
actually possible. So I do feel strongly that therapists need to have their own healing journey in order to be a safe presence for their clients without having the need to disclose your own story at times.
Yeah.
Mhm.
Going back to when you were saying, you know, finding the right practitioners or people to help you. I mean, what you just said is the mark of an incredible practitioner. I think the listening and especially for females, like use what we have, the tools in our toolbox to share our lived experience, share our stories. That's how women can connect.
Mhm.
And I think that's amazing. Like, good for you for bringing that into your practice. And my next question would be, how did you get from there to diving deeper into, somatic
Mhm.
specifically,
Yeah.
and your modalities? Yeah.
Well, funny enough, my first experience was with therapy when I was 16. I was dealing with a lot of bullying in high school and just a lot of really difficult anxiety and depression. And I went to a therapist who stared at me with no facial expressions, didn't say much. Um, I felt very uncomfortable, very unsafe. And I learned how to mask really, really well. I learned how to tell her I was
Mhm,
fine.
mhm,
Um, I didn't feel safe to be vulnerable or talk about anything that was important. So the that being my first experience with therapy has really helped me shape what kind of therapist I want to be and what
yeah.
I feel like is important. Um, the idea that we can have therapy, maybe like pure cognitive behavioral therapy, and not incorporate the body feels very misguided and misaligned with what
Mhm,
kind of true healing looks like, right? Because our nervous system is essential when we think about going back to deeper processing and working
mhm,
with deeper memories and reactions and what shaped us when we were younger in our childhood and throughout all our years, right? Because our nervous system remembers and it's going to come back as a reaction or a trigger
mhm,
or a felt
mhm,
sense, right? When you're anxious or if you hear a door slam, you might have a physical response, right? Your
mhm,
stomach might tighten, your heart might race, your palms might get sweaty. That's your nervous system protecting you, right? And
mhm,
alerting you that something feels unsafe. So when we work with somatics in that way, we're really taking in the whole person
mhm.
and really including the nervous system, which I feel is just essential.
Yeah. I personally have been in therapy for 20 years, even though I'm 25. Um, um,
Same.
but and really recently, I think because I personally have been struggling with like the reparenting aspect of things
Mm,
and talking to my own therapist of there's something missing. And
mhm,
it's like if I feel jumpy in a situation and it's just a dog passing by or something, or I feel that tension in my body. So that's why I'm so excited to learn more from you both because I think it's really important for women to understand what those additional modalities are that they can tap into. Um, and Emily, do you want to just give us a brief background on the modalities that you specialize in?
Yeah, for sure. So I started therapy when I was like 12 or 13 for
Mhm,
disordered eating,
mhm,
unsurprisingly, in the
mhm.
dancing world.
Yeah.
And having that space was, in my mind, like the coolest thing ever. It's everything that I needed as a teenager, and I'm really lucky that I got it. And it sparked my interest. Like from that point on, I knew that I wanted to be a therapist. And I always knew while I was in grad school to become a therapist that there was, like you said, maybe something missing that we're not really talking about all the time in grad school. Usually, grad school
Mhm,
for therapists focuses on more of a cognitive approach because, unsurprisingly, that's what insurance companies pay for because it's short term and it's brief and
of
it gets the job
course they
done.
do. Of
Yeah.
course.
So there's, largely missing is the somatic approach. And
Mhm, mhm,
I think until COVID, like, people didn't even know what trauma was. Like, trauma wasn't a
mhm,
word that was commonly used. And so now we're starting to see a turn of people taking more somatic and what we call like bottom up approaches
mhm.
more seriously. Um, so in grad school, I knew something was missing, didn't have the language for it, didn't know what it was. And then I found IFS therapy, which is the primary modality that I use. And it incorporates like a very relational lens and a very somatic lens as well. And I just feel like it encompasses exactly what I feel therapy can and should be. And
Mhm, mhm.
it's great. I love it.
How has IFS helped you now? Like, how do you use it for yourself?
Yeah. So I work with an IFS therapist, and
Mhm,
IFS is incredible for so many reasons, but like you were saying with kind of the reparenting, one of the components of IFS is going back to all the parts of you that didn't get their needs met growing up or at some point along the line, and
mhm,
actually doing that reparenting from your healthy adult self. And so I think there's so much healing power that we have within ourselves that
mhm.
we sometimes don't even know. Like we think we need a provider or an expert, but actually the healing power lies within the emerging adult healthy self that we all
Yeah.
have.
That's so interesting. How many childhood selves can you deal with at one time? Because I think I have several.
Yeah, so we all have a ton of different parts, which is
Mhm,
the language IFS uses, and
mhm,
the young, vulnerable parts that didn't get their needs met are the parts we tend to kind of like shove away and never want to
mhm,
revisit. But
mhm.
they are the ones that are constantly being triggered. So we call those exiled parts, and they're again the young, vulnerable parts of us. You can have as many as you can think of, as many as you're probably thinking of right now. The limit does not exist, unfortunately.
Yeah, my
Uh,
mind went to like, "Oh, my parts are schizophrenic." And there's lots of things, but yeah, I think that's so interesting to sort
yeah.
of look back because if I'm thinking about or truly engaging with my body and my reactions to things, like
Mhm.
I can figure out where those triggers are, but it takes me a
Yeah.
while to dive into that.
Right.
And so it sounds like you're able to do that, like really help women to get in tune with what those like specific reactions are and what they're tied to. Is that
Yeah.
right?
Yeah, exactly. And we all have a lot of protective
Mhm,
parts like perfectionism, people pleasing, disconnecting, all the things that we've talked about so far. And those parts are trying to keep us from experiencing the trauma or the young, wounded, vulnerable parts, if that makes sense.
yeah.
So, a lot of times, if you're feeling like triggered, like you said, it's actually a young part that's resurfacing. That's like, I need your attention and I need you to pay attention to me differently than anybody else ever has.
Mhm.
And so we can go back and connect with those young parts.
So I didn't get your consent, Catherine, but if you were to look at Catherine and the not having her voice heard when she was younger, how would you address that with someone in
Yeah.
IFS?
So, usually we'd start I usually start with the body if it's possible. So, like,
Mhm.
Catherine is very connected to her body, which I already know, and I can kind of sense that if she was my client. Um, and we'd probably start with the sensation maybe in her throat or around her thyroid that she experiences. We'd kind of tune into that and really get a sense of what that experience is like. And then we can almost start visualizing it as maybe the young part of her that wasn't able to speak up or wasn't able to say something which she needed. And we can start working with Catherine's adult self and Catherine's young, let's just say I'm making this up, but like 7-year-old self who couldn't
Mhm.
speak out. And
Mhm.
we can start basically building a connection and a dialogue with this part, really learning about it, learn how like how was not speaking out actually really protective and maybe keeping her safe at the time or keeping
Mhm.
her away from like trouble or danger or something like that. Um and really what that does is builds up a whole new understanding with a much more compassionate framework because as women, we tend to be really hard on ourselves and bringing the compassion can be difficult. But
Mhm.
when we really understand, like, oh my gosh, this is a part that has been trying to keep Catherine safe for so long, we have a whole new lens of looking at her and her lived experiences.
Mhm. That's so interesting. Are there other modalities under the somatic umbrella that you can share as well?
In terms of the type of work that I do,
Or just in general to, educate our audience on, like, if it's EMDR or
yeah.
other modalities, just kind of like a quick, how do we differentiate these things?
Yeah, for sure. I think the main point is kind of separating like traditional talk therapy from somatic therapy,
Mhm.
and they're not mutually exclusive. So, like, I know Catherine and I both practice talk therapy and we incorporate somatic work. But the point is really to get deeper because trauma and all of our experiences live in our body, even if we
Mhm.
try to disconnect from them. So
Yeah.
I mostly use IFS. Catherine, I know you use a lot of other types of somatic work if you want to take it
Yeah.
away.
Yeah, I
You have
really
your magic wand?
I do.
Her
This
face lights up.
this is my
Tell
brain
us. Harry
spotting
Potter, I
wand.
love it.
Yeah, so IFS is an incredible therapy. I really enjoy that too. Some other ones, like you mentioned, is EMDR, which is eye movement desensitization and reprocessing therapy. And that uses a lot of bilateral stimulation. The whole idea behind that is to get your left brain and right brain more connected.
Mhm.
And you can use this to safely recall traumatic memories. And with EMDR, it's a highly evidence-based practice that has a specific protocol. And as someone who has been a client to it and has been beginning to get trained in it, I think it's extremely powerful.
Mhm.
One that I am trained in and really love is brain spotting. And brain spotting is a neuro experiential therapy that uses eye positions to directly access trauma stored in the body and subcortical brain. So essentially,
Wow.
like where you look affects how you feel. So even as if you might be talking about something that's emotionally charged or you're witnessing someone talk about it, you might notice that their eye positions might look in different directions. So, that is just a basic understanding that when we're talking about something emotionally charged, our eyes might move in various ways and in different parts of our like visual orientation in space. So that's where with brain spotting, this magic wand can come in and it can help you focus on what we call a brain spot, which can help access more of your implicit memories that's again in more of your subcortical brain. So we're not really working with your prefrontal cortex, we're working with your midbrain, your hindbrain, and we're doing it in a really safe, indirect way that reduces a ton of shame. And
Hmm.
that's why I love somatic therapies because often with you are like narrating a trauma or something has happened to you, shame is right there with you, right? Because shame craves secrecy. Shame is
Mhm.
going to do everything possible to keep those traumatic memories below the surface, right? So when we're
Mhm.
actually narrating it and talking about it, our body is naturally going to maybe protect ourselves, and that shame is going to tell you, hey, no, we're not going to talk about that. So with somatic therapies, we can kind of indirectly work with implicit memories and the nervous system directly that you will notice kind of really interesting shifts after, like with EMDR or brain spotting and IFS or yoga therapy, dance movement therapy. You might notice you feel more tired in between sessions. You might need to take a nap after a session. You might feel like a little bit not as sharp, right? Because that's part of the healing process. It's your body is really truly working to create new neural pathways,
Mhm.
which can be done, of course, with, traditional talk therapy, which don't get me wrong, is extremely valuable. Extremely. Like, especially if you have a solid therapeutic relationship and you are feeling seen and heard, that can be work wonders. When
Mhm.
you throw in that component, or if you're feeling like something's missing, that's where you might want to dive into brain spotting, EMDR, IFS, which can naturally support that traditional talk therapy experience.
And so, how do you help women navigate that space? So, for me, for example, you know, how do I know whether I'm going to go to someone who specializes in IFS or EMDR or, you know, how do you know what's going to work for you as an individual?
That's a really, really good question. And I feel like it's so common where people might want to find a therapist but have no idea who,
Mhm.
where, how, and what kind. And I
Mhm.
feel like my best advice would be when you search for a therapist, see if they have what kind of training. When they say what their, niche or what niche or what they're trained in, um, when you actually, hopefully they offer a free consultation, I feel like most therapists should, you kind of want to interview them and say, like, what do you incorporate somatics into your therapy? Are you more,
Mhm.
what kind of theoretical framework do you use? And I think the most important thing to know is that every single person would benefit from somatic therapy.
Mhm.
Yeah.
Everybody would benefit from therapy in general, but you don't necessarily have to know if you need EMDR, brain spotting, or IFS, but I would search for somebody that at least has somatic
Mhm.
practices to support your journey because you would benefit from it.
Right.
Mhm.
And I think, I mean, in just talking to you both, it also just sounds like the professional is so important. That connection almost supersedes the type of modality they're offering in some aspects because you have that relational component.
Yes.
I found that with therapists in general as I've navigated my way through different folks over the years. And I think to your point earlier, Catherine, you don't want to find someone that is just like sitting there with their wand watching you
No.
silent.
No, yeah.
um,
Which is funny because brain spotting has a lot of silence in it. And I think, but it's a different kind of silence because
yeah.
you are one of the most basic components of brain spotting is your attunement to your
Hmm.
client. And your
Hmm.
client wants to feel like you are being safely held with whatever is going to come up. And
Hmm.
silence is a big part of it can be a component of EMDR and brain spotting because we're working with the body. The body's not talking, right? We're
Right.
listening to the body and
Hmm. Hmm.
feeling and supporting in real time, which offers
Hmm.
a very different kind of processing. Um, so silence certainly can be helpful, yet if
Yeah.
you don't feel connected to your therapist, you
Hmm.
don't feel safe to be vulnerable, that's a big red flag.
Yeah.
Yeah.
Are there
Yeah.
any other red flags to look out for as women are navigating finding a practitioner?
I think
Mm.
different therapists probably vary here. And I would say that the most important thing is you want to feel like you can trust your therapist and that
Hmm.
will take time. But if you don't feel like initial connection right off the bat, it's something to maybe think about. And if you feel like you're spending most of your therapy sessions venting
Hmm.
and
Yeah.
not processing, um, that would be something to be curious about that maybe
Hmm.
maybe to bring up with your therapist.
Mhm. Um, it sounds like, especially somatics for women, kind of helping them through every life stage would be really useful because I feel like we're constantly learning about our bodies at every stage in a new
Mhm.
way.
Yeah.
It's like new body image, new hormones,
Mhm.
new cortisol, which we can get to in a moment because I need some help differentiating cortisol from the vagus nerve and the nervous system. But um, would you say that that's accurate, that women that are going through some of these bigger life transitions like pregnancy, postpartum, perimenopause, menopause, that somatics would be really a useful tool?
For sure. Yeah,
Mhm.
yeah.
Yeah. Absolutely. Like women's bodies are always evolving, right? And there are certain hormonal components that become very part of our everyday life. So, kind of
Mhm,
knowing that how we might be able to balance our hormones in a way that directly supports our nervous system, I think
mhm,
that's key. I think that's so important to understand.
Yeah. I also think that a lot of times women tend to be very self-aware and intellectual. Like we might know and
mhm,
understand our relationship patterns and why we do certain things and how we respond in certain ways. But there's a difference between like knowing the pattern and having connected the dots or made sense of things,
mm,
which is
mhm,
what talk therapy is so good at doing.
mhm.
There's a difference between that and actually feeling and connecting with your body and experiencing the emotionality behind it. Those are 2 very separate things that can happen within talk therapy and somatic work.
Got it. That's super helpful. Back to my nervous system question, because everyone on social media is like, take this cocktail for your cortisol,
Yeah.
fix for your nervous system. What about your vagus nerve? We'll calm that baby down. Like,
Yeah.
how do we, how do, how are they connected? How do we address all of them? And what does somatics actually work with?
Yeah. I think that's an amazing question. And there's definitely a lot to it. I feel like with somatic therapies, we work with kind of traumatic experiences that are stored as like implicit memory, right?
Mhm, mhm,
So the sensations, motor patterns, emotional states, rather than like our explicit verbal memory.
mhm,
And understanding like just a basic overview of the nervous system, how we have two branches, the sympathetic and the parasympathetic, and when and how what's being activated, right? So the sympathetic nervous system is more our fight or flight. Parasympathetic nervous system is our rest and digest, right? So the vagus nerve is the biggest nerve that we have that runs from our brain all the way down to our gut area. And it's crucial because it sends signals from our body to our brain to understand how we might slow our heart rate down, how we can stimulate digestion, right? And we know that there is a big huge connection between the
mhm.
gut and brain,
Yeah.
right? Um, and when we're able to activate the vagus nerve, we're able to connect to the parasympathetic branch of our nervous system and physiologically slow our body down.
Mm,
So that's why you might hear people doing like hack your nervous system through your vagus nerve. And those can be great to try on. My also suggestion is to explore that within the context of a therapeutic setting and the therapeutic relationship, because that therapist is going to know your unique system, right? Because we have to make sure we have some kind of cushions, right? Some
mhm,
safety cushions. So we want to know maybe where our triggers might be. We want to understand what might make us flood. So flooding is like when we have maybe overwhelming amount of thoughts, feelings, sensations that
mhm,
feel difficult to control and to basically be able to regulate ourselves.
mhm,
So within the therapeutic relationship, we're going to find ways that are more grounding techniques. So we can do something called like pendulation. So that's within somatic experiencing from Stephen, no,
Stephen Hawkins.
let me get my Peter Levine. Peter Levine is
Oh,
like
yeah.
the
Okay.
Peter Levine is the master of somatic experiencing. And the whole idea of pendulation is that like we can move gently between activation and safety states, which help our body discharge like an incomplete survival response, right? So
Mhm.
this would look like if we are exploring a feeling that feels very physiologically triggering, we're going to pendulate to a place that feels grounding. Okay, so let's say we're talking about a car accident and we're noticing that we have a really strong increase of heart rate.
Mhm.
We might have palms sweaty, we might be shaky. We're going to pendulate into, all right, well, how can we ground ourselves and soothe ourselves? So, can we feel our feet on the floor? Can we notice how our body is connected to the chair? Can we orient ourselves visually to the room and the space? So, finding some safety grounding techniques. And then we can move back into maybe some of the more triggering states where we're activated. And moving through those states back and forth helps our nervous system practice that we are
Mhm.
safe and we can work through those activation triggering reactive traumatic responses that are really stored within our nervous system in a safe way.
Yeah. So that's like if I'm having, and again, because I'm parenting, going back to when I have big feelings and women, we are overachievers, we are
Yeah.
overthinkers, we carry the mental load. I feel like if I am at that point, it's like a huge, bang of a moment, right? Like
Mhm.
it's an
Mhm.
explosion of a moment. And so you're saying that you can create that safety with just being present with your body and helping you to sort of reconnect in that moment.
Absolutely. I mean, I think it comes down to our ability to regulate, right?
Mhm.
And that's also kind of a buzzword maybe within the nervous system and what's happening now with wellness trends. And it's hard to learn how to regulate when you never learned how to co-regulate. So
Right.
inherently within the therapeutic relationship, you're learning how to co-regulate with someone witnessing you, right? And holding space for you. And when you throw in certain techniques like pendulation and working through triggering states to grounding states, our body is learning how to regulate.
Mhm.
So that can be generalized and move forward into when you are just done with being a parent and you're feeling extremely stressed and you just have some mom rage, which is
Mhm.
also valid. And it's not something that we like just fix. It's a
Mhm.
journey,
Right.
right? You're still human. You're still going to feel mom rage. You're still going to
Mhm.
have like your window of tolerance be completely tapped out at times. That's
Mhm.
okay. Like in those moments, it's more about repair,
Mhm.
right? And that's how you learn how to co-regulate and how your child co-regulates.
Right. I mean, as I was sort of building, I just kept coming back to the fact that I can't help my daughter learn about her body because I don't know that, and I need to keep getting in touch with that. And I think the somatics really can open you up to sort of the full picture.
Mhm.
Um, I would love to talk more about the trauma in your body that we're trying to assess. Women, I feel like every woman in my life has hip pain.
Mm.
Is that, you know, our anatomy? Is that pregnancy, postpartum, what have you? Or is that actual trauma? Tell me a little bit more about that and how we differentiate what actually might be an ache and pain versus where trauma could be stored.
Mm.
Trauma is definitely stored in the hips, which is why every time you're in like pigeon pose in yoga, you start crying, or at least
I can't
Mhm.
even get into pigeon pose.
well, so some of it might be pregnancy too.
I'm like 6 feet off the floor in pigeon pose trying to get down.
Hmm.
Uh,
Yeah, but that's interesting, and that's something to, like, be curious about because you're
Yeah.
absolutely right. There is a lot of research behind, like, how we store, trauma in our hips, and especially, like, when we might contract our body to protect ourselves, usually we might feel that in the hips or in the small of our back.
Oh, I have
And
that too.
yeah, and
Yeah.
when we notice where we hold tension, and that could be
Mhm.
different for everybody, right? I tend to hold more tension in my shoulders, and that can also be having to carry and juggle a lot. There are certainly people that hold it in their jaw, in their
Mhm.
throat, in their stomach, um, chest area, all it's going to be stored uniquely to the person.
Mhm.
Um, One way to maybe notice, right, is where you feel the tension. So if cat, it's difficult to release into pigeon pose, you might get really curious about what comes up for you when you
Mhm.
actually activate and even explore the beginnings of pigeon pose.
Yeah.
I think that's where yoga therapy and certain somatic poses can be just really insightful into how you learn about your body.
It's so interesting that you bring it up because I was in a hot yoga class last week and I just started sobbing
Yeah, yeah.
when I was in one position because I was just like, I think everything that I was, sort of dealing with at the time was being released.
Mhm.
And I've heard that from several friends in general, but would you, in addition to yoga or somatic movement, is there anything else, physical therapy or, dance movement therapy that can really be a complement to somatics in that way?
Do you mean like okay, I would consider yoga therapy and dance movement therapy, they are somatic therapies?
Okay.
Is that what you're asking?
Yeah, just meaning, kind of back to my first question of, I'm cat deaf. I'm coming to figure out how to get in touch with my body, and is finding someone that does IFS or um, brain spotting or what have you, and perhaps they don't do any yoga or
Yeah.
physical movement.
Mhm.
How can I pair another modality with that so I can sort of get best of both worlds?
I think that any type of physical movement, and I'm not talking about like running a marathon or
Mhm.
doing a HIIT class, but even just like a gentle walk, or I encourage my clients to put their legs up the wall or just
Mhm.
do a little bit of stretching. Because so often as women, we are, like you said, we're over functioning, we're go, go, go. And we avoid checking in with our bodies because we think it's going to make us like slow down or not be
Mhm.
productive or potentially become overwhelmed or flooded. So, any type of practice that you can find that you are aligned with,
Mhm.
where there's some sense of just checking in with your body. Like, I don't want to oversimplify it, but it is so much about just becoming aware of our body, our nervous system states, even the process of like, what does it look like before I become totally dysregulated and like
Mhm.
yell at
Mhm.
my partner or yell at my child or whatever? Learning what is happening in your body in the lead up can be such an effective tool too. So, any practice that is connected to like coming home to your body and learning your body and its sensations is
Mhm.
going to be beneficial.
Yeah, I think that brings up a really important point of this sometimes this all or nothing mentality that a lot of women tend to have, where it's like, I have to go to a full-on yoga class or I have to run like 6 miles in order to regulate my nervous system effectively. Well, let's definitely debunk that myth because all or nothing thinking breeds perfectionism and it's
Mhm.
unrealistic and unhealthy. And I'll give an example. Let's say you're feeling really depressed and it's difficult to get out of bed. So, one way we might explore and work with that is really like naming and feeling what is going on inside your body when you wake up, when you
Mhm.
might feel very overwhelmed. I'm not going to tell my client, you got to get up and go to a yoga class or you got to go run your. No, absolutely not. Right. We're going to start exactly where the client is. And we might even just explore what it feels like to move our fingers, to move our hands, to maybe slowly just notice what's going on in our body.
Hmm.
Going to start really, really small. And it's the tiny steps that's what really does the healing, and how important that this all or nothing thinking kind of cognitive distortion, which is so prevalent for women,
Hmm.
that it's completely unattainable and it's not realistic, and it triggers the swing of fight or flight to complete dorsal vagal shutdown where we are immobile.
Right.
Um, yeah.
It's definitely about balance for women,
Mhm.
and the noise is so increasingly loud. The
Mhm.
messages are telling us to do more, take more, consume more, when going back to basics is probably the answer.
Yeah.
And I think, you know, as you're saying that, the paced approach, just like one thing at a time, I think is so important.
Mhm.
Could we collectively come up with something for women? It's like, you know, for everyday tips on when you wake up, how do you get in touch with your body, assess yourself, do a scan, and then also throughout the day, little things where you can reconnect and try to calm your nervous system, you know, kind of in between sessions of somatics.
Mhm. Yeah, I think one thing that I've learned through having like a solid meditation practice finally
Mhm,
after trying
mhm.
to integrate it in my life for so long is
Yeah.
we want to break things down and make them attainable and manageable. And if we tell women to like have 30 minutes of check in time for themselves every day, they might not do it because it just
Mhm,
feels unrealistic.
mhm,
So I like to think of like every time I'm transitioning into the next thing that I'm doing, like even if it's unloading the dishwasher or getting in my car, like,
mhm,
is there just a moment to pause, to check in? Notice what's going on in your body. Like, notice how you're feeling in terms of where you normally hold
mhm.
stress.
Oh, there it
So
goes. Yep.
yeah, like my shoulders are always up.
Yeah.
So just as much as you can, and then it becomes more of like a subconscious process and you don't have to actively think about it all the time.
Mhm,
But I even tell clients like set a reminder on your phone for morning and night of just check in with yourself. You know, it
mhm,
doesn't have to be anything long, but can you check in for 30 seconds and just say, in my language, like what parts of me are activated or where in my body feels like it has a lot of energy or tension.
mhm,
Um, Something as simple as that can be life changing and can help you feel connected to yourself, which in turn helps your nervous system feel
mhm.
calm and regulated as well.
Yeah.
I love what you were saying about the legs up on the wall. I
Yeah.
know we have so much, like, our lymphatic system is so stagnant in our legs, especially at the end of the day for women, and so doing that before bed is, like, one of my favorite things.
Mm.
Yeah.
Um, and I've been trying to in the morning. I had seen this, I think, back in COVID when I was pregnant, and it was before you get out of bed, you take, like, 3 good, you know, square breathing, how
Yeah.
whatever breathing technique you prefer. And then you sit on the side of the bed with your eyes closed and you put your feet down and you try to ground yourself
Mm.
and do the breathing once more. And then whatever your thing is, if you like to set an intention, if that's not your thing, if it's like you were saying, Emily, meditating, or if it's just like saying one thing you're grateful for,
Mhm.
Mhm.
that has just helped me just set the day up for success. And also not looking at my phone for the first
Yeah.
half an hour to 45 minutes.
I was just about to
Mhm.
say, like, moving through that process without
Mhm.
grabbing your phone first, because
Yes.
your anxiety and your nervous system,
Mhm.
first thing in the morning when it sees even just the light of your phone, even if it's
Yeah.
just the clock, it
Mhm.
sends your
Mhm.
system into overdrive from the beginning.
Mhm.
So
Yeah.
if that's like one tip, like don't go on your phone for a
Mhm.
little, even if it's 5 minutes in the morning, like just
Mhm.
give yourself time to wake up because it will set the rest of your day in a different path.
Right.
Yeah.
My husband is on his phone first thing
Mm.
in the bed on his emails, and I'm just like, we need to push it back
Yeah.
because you're setting yourself up to be in that moment to be reactive versus proactive, and you're not able to take control of your day.
Mhm.
Granted, things come up, but I totally agree with you. It's just like everything can wait. You can have that half an hour.
Yeah. I think it's also important too, like, as an elder millennial parent, I sometimes wake up with a 4-year-old foot in my face, right? I might
Yeah.
get a headbutt as a wake-up call, and that can be really hard,
Mhm.
and we can work through that, right? So
Mhm.
what I might do is, like, notice, that's the best way to wake up. I'm gonna just, like, look into my 4-year-old's eyes, and I'm gonna give them a hug because I know that that hug is gonna regulate me, right?
That's awesome.
And, every morning might feel different, but something that can be a little bit more of a routine that focuses on your own needs, that's a game changer for your nervous
Mhm.
system.
Yeah. I hear you on that, and I've been trying to be more mindful of those moments that really fill my cup physically, or I
Yeah.
feel everything release. I had a
Mhm.
similar experience yesterday where, we have our fantastic launch coming up next week for Gen
Yay!
Well, where you both will be a
Woohoo!
huge part of what we're pulling together, and so I'm so psyched. But as one does with their head cut off, I was racing in. I had, 6 to-dos on my mind and my mental load, and the door opens and both of my kids were like, "Mom, mom," and running and screaming to me, and I just scooped them up, and
Mhm.
we were just giving, like, big hugs and kisses, and I just, like, dropped everything, and I'm like, "Okay, we're just for the next, like, half an hour just gonna sit here and, like, enjoy each other," and I was
Yeah.
like, "Oh, I'm so grateful," and I just felt myself kind of release the
Mhm.
mental load for a minute, even if it was picked back up,
Yeah, talk
in
about
that
the
half an hour later, but it
mhm.
truly makes a difference, and you
Yeah.
guys are doing some incredible work.
And
Thank
that
you.
can definitely be generalized to your partner or a friend, right?
Mhm,
Where you really are witnessed by just another human being and you
mhm,
give them a hug or you
mhm.
look at them, really look at them and,
Yeah,
connect, right? Because that is essential for our survival.
mhm.
Um, so it can be anything that really gives you that moment of co-regulation. If it's a tree, not around anybody, go hug a tree, touch
Go
grass. I
hug a
mean,
tree.
if you talk about cortisol, that is really how we lower it. And it starts in the morning. It starts with looking at the
Yeah,
sun, right? I mean, those are evidence-based ways we lower our
mhm.
cortisol in the morning.
I mean, the state of the world right now, everyone needs to go find a fucking tree.
Yeah, I wish I could grow one in next to my bed.
Yeah.
Yes.
100%. One last question for you, Emily, about the IFS aspect
Mhm.
is I'm very aware that I have had childhood trauma, as I mentioned earlier, but people that are not as aware or they don't know where their triggers are coming from or they suspect that everything was fine and, sort of kosher growing up.
Mhm.
How would you sort of, um, not sell them, but how would you showcase the benefits to them if they're not aware of if they've experienced any of those things?
Yeah. So you don't have to have any semblance of trauma, like big or little,
Okay.
to benefit from IFS.
Okay. Great.
IFS is really about getting to a deeper place of self-connection with
Mhm.
yourself. So IFS can be applicable to anybody. I happen
Great.
to work with early relational trauma. So like my
Mhm.
work is kind of focused around that.
Mhm.
Um, but really, IFS is just about building a closer relationship to you, to the parts of you that have been trying to protect you, because we
Mhm.
all need protection as
Yeah.
humans, um, and is a way to develop a connection with your body and your early experiences, traumatic or not.
Yeah. One sort of last general question on somatics, and then I want to talk about a few things before we go on social media. Um, just in terms of body image in general, we were talking about that. The three of us share our background in dance, and that was obviously hugely prevalent for us, but I
Mhm.
would say for women in general at every life stage. How does somatics help with the body image aspect versus, you can't feel that necessarily. So how does that sort of come into play?
Hmm. So one image that really pops into my mind is a woman looking in the mirror, right?
Mhm,
And we're taught to believe and criticize every aspect of our body.
mhm,
Therapy, and particularly somatic therapy, because we're working directly with the body and understanding our body in a really compassionate way without
mhm,
shame. It's bringing that woman close to the mirror and giving her a hug, right? So you can see that shift in that
mhm,
visual. That's how that's our what we try to move towards.
mhm,
And just body image is traumatic. It absolutely is. And women are up against a really big force field in how you consume social media, what
mhm,
is said to be, how you should look. I feel a lot for our younger generation who are
mhm.
constantly being exposed to social media and do not have the cognitive skills to create boundaries.
Right.
It's toxic, it's dysfunctional, and it is a
Mhm,
difficult force field to work against. With body image, one of the most foundational shifts that you can create with your body is creating compassion and naming and accepting all your body, what it's been through, and how it's showing up for you today. And
Mhm.
there's a lot of healing and grief and sorrow. Um, and a lot of compassion that we can extend our bodies. And when we do that to ourselves, we're able to extend that outward to
mhm,
other women.
Yeah.
And that's how we create change. That's what you're trying to do with Genwell, right? You can
mhm.
sit with us, right? That is the
Right.
foundation that women should be supporting women, and
Mhm.
we can change the world that way.
Mhm.
I love that.
One thing that is kind of a very specific example that I'd like to add in terms of body image, everything Catherine said in terms of building compassion, that is all developed through somatic work and through connecting with your body. But it took me going to a somatic therapist to realize that I had been essentially breathing wrong my entire life
Mm.
because
Wow.
basically in order for your nervous system to feel safe, you need to be taking deep diaphragmatic breaths, like all the way down to your belly. Let your belly expand out, and then you can release it, and your belly kind of pulls in. Well, I realized as a dancer, and as a woman, we're constantly taught to suck in, right? Like pull in our stomachs.
Mm.
Yeah.
My breath was really only going to like my sternum and not
Mhm.
ever really going like fully down to my belly.
Wow.
And that inherently sends a signal to my nervous system that something is unsafe. I'm breathing quickly, I'm not breathing deeply. And
Wow.
so, even just the shift of noticing like how I sit most of the day in sessions, it was kind of putting my forearm like over my belly, like sucking in a bit
Mhm.
and moving into a place where like I sit up straighter and I fully allow my breath to travel and for my belly to expand rather than suck in. Like that has made me feel safer in my body and more connected to my body. So
Yeah.
I think that's a really cool example of just like it sounds small, but it's actually really life changing.
Mm.
That
Mhm.
that sounds life-changing. I would love to know if there's a specific breathing technique that you do.
No, just, like, breathing in and letting my belly it sounds so silly, but my therapist was like, "Where is your breath?" And I'm like, "It's just in my chest." And she's like, "Can you breathe deeper and let your belly expand?" And I was like, "Whoa." So I think just learning what a diaphragmatic breath feels like
Yeah.
Mm.
and then practicing that when I go into the state of kind of the quicker, dysregulated,
Mhm.
fast-paced breath, and then coming back to like, okay, you can inhale fully and deeply. And
Yeah.
even just that sends a signal to my nervous system of like, okay, we're safe. It's cool.
Mm.
That's so incredible that that worked for you. That is life-changing.
Yeah.
Um, I have a funny quick story where I feel that too. Like I sometimes I'll notice that I haven't taken a breath and just I'm sort of stuck.
Yeah.
And my husband he was never into breathing, and I've gotten him into breathing, and
As men aren't.
as we do. As we do. And we were going on a trip with his coworkers, and I remember being in the airport, and I'm gonna say I'm a better traveler than he is. He was like definitely heightened sense, and it was palpable. He was getting a little anxious. And so we're standing in front of the gate, and I just hugged him and I was like, let's take a deep breath together. And we always do like a series of 3 deep breaths and sort of box
Mhm.
breathing. And so our eyes are closed, we're holding each other. And then someone taps him on the shoulder after the 3rd breath and he's like, yo, bro, how are you? And it was one of my coworkers. And we just sort of let out this burst of laughter. And it was just a nice moment because I was like,
Aw.
okay, he feels comfortable in a public setting to do this, where I
Mm.
think the stigma has thankfully gone away, I think, for therapy. But like in a public setting, some people may feel uncomfortable. I was hiding in my husband's arms, so maybe that was part of my shield. But I think there is such an importance, like even if you feel uncomfortable finding a space, if you're at the airport, if you're at work, if it's in the bathroom, to find that moment of grounding,
Yeah.
because you're right, the breathing is so important. And it actually got me thinking too of, I'll add it in the show notes. There's a gal that I follow on Instagram who does a lot of workouts where she breathes into a balloon.
Hmm,
And
Mm.
it's mainly for pregnancy and postpartum, but it's really important for women just for general pelvic floor health.
hmm, mhm,
And my question to you is, if you have trauma stored in the pelvic floor, is that a
hmm.
thing? And if so, what causes that?
Mm.
Yeah,
It's
I
definitely a thing.
it's
Yeah.
definitely a thing, and I mean, eh, birth, trauma, all of
Mhm.
that around how your body is holding
Mhm.
certain things. I mean, can be extremely traumatic, and we don't learn, and it's not taught to us how to support our pelvic floor. I didn't even know what a pelvic floor was at one
Right.
point, right?
Right. Right.
Had no idea. And breath and our pelvic floor is intimately connected.
Mhm. Mhm.
Um, and breath itself can be scary for a lot of people, especially with
Mhm.
complex trauma, complex PTSD. Sometimes just breathing can feel really, really scary.
Mhm.
And that's where therapy can be really extremely supportive. Because again, you're being witnessed, you're being held, and you're being guided by someone that is not going to let you become so flooded that you can't function.
Mhm.
Mhm.
Um, don't know if I just went on a tangent.
No, that was great. Um, to switch gears for a moment, as we know, this social media misinformation is rampant. Gen Z is exclusively getting their health advice from social media. Um, when we're y- or sorry, when you guys both have social media accounts, how do you deal with sort of negativity, negative comments, or putting yourself out there in general? Because as we were talking about body image, that is so difficult in general, but for women as well. Just wondering how your background factors into how you kind of regulate yourself in those moments of vulnerability.
Mhm. I really try to be boundaried with social media in terms of what I'm putting out there, and I make sure that everything that I put out there is authentically aligned with myself and what I
Mhm.
believe. Like, I
Mhm.
try not to
Mhm.
put a lot out that can be scrutinized, I guess, just in service of self-protection. I'm not somebody that posts like a ton of controversial things. I post about the topics that I have expertise in and about
Mhm.
my niche, and I hope that that's helpful for people. But if there ever is a time that I get negative comments, I know like I get very anxious about that.
Mhm.
And I try to kind of come back to the fact like, okay, this is what I believe in. This is important to me. It might not land with everybody, and that's okay. Um, and take breaks on social media. Like when I feel misaligned or I'm fatigued or I'm not feeling creative, I try to give myself the permission to step away from it. And I feel like every time I give myself a break, I come back with more energy,
Yeah.
which is applicable to everything that we're talking about
Right.
and social media. But it's hard. And it's hard being a therapist on social media because we don't it's all a new thing. Like, a lot of therapists are doing it, but we don't get any, like, book of ethics around it in grad
Right.
school or, um so I try to just make sure I'm being as, like, ethical as I can be
Hmm.
and as aligned with myself as I can be.
Yeah. In
Yeah.
terms of like ethics and biases and all of that, the question of AI and where that fits in with therapy. Many, I would say most people are using it in some capacity for to dos or to help them with work. I've had several friends that have asked therapeutic questions, um, not replacing a doctor, but meant to supplement what they're already doing. Do you have any tips to navigate AI versus these unfortunate stories we're hearing
Mm.
where youth and people are relying on AI specifically for guidance? And it's really alarming.
Mhm.
Mhm. Yeah.
Yeah, I think based on everything Catherine and I have shared, I think that there's no like, AI cannot replace therapy. There
Hmm.
needs to be the relational element, there needs to be the human
Yeah.
element, and I understand that a lot of people can't access therapy, and that could go into a much wider conversation of, like,
Mhm.
until insurance companies reimburse therapists properly and start paying for treatment and make it easier, people aren't going to be able to access therapy, and that's a problem
Hmm.
because people
Hmm.
need therapy, they need support.
Yeah.
Um so I think, I don't believe in AI replacing therapists. I don't believe in using AI for my notes. Like, I know a lot of people are doing that. Therapy's human and we need to keep it that way,
Mhm.
in my
Yeah.
opinion.
Yeah.
I completely agree. AI, ChatGPT, that's not a human, right? And that a robot is not going to be able to pick up and have a felt sense of nuances that come with every session, and everything that is said, and all of the nonverbals that a client brings into a session. Like that's what we're trained to also pick up on, especially with somatic therapy. We
Hmm.
are we are really taking in the whole person, all of the things that they're not saying, what they might be doing with their body. And I completely agree with Emily. There is a macro systems issue with the lack of access to therapy, why insurance companies are so difficult to work with, and why therapists don't and can't take insurance sometimes.
Hmm. Hmm.
So that's a really big issue going on right now, and I can see and the appeal of why young people might turn to AI for support. Like m- the one thing I could stress enough is that go to a safe person. If there is one safe person, if it's a teacher, if it's a coach, if it's your mom, if it's your dad, if it's your sibling, if it's your friend, shame is what keeps us from telling the human person,
Yeah.
right? And somehow the
Hmm.
robot diminishes the shame and that we can just pour it out there. Well,
Hmm.
in therapy, that's what therapists are trained to do. We're not going to increase your shame. Effective therapy is going to really see you as you're coming and what you're bringing into the session. And I feel like that's you can't recreate that.
That's so powerful. I would say there's something else on social media that is bothersome, I think, for me personally, because I am so interested in marrying sort of modern science and various different modalities. And I think we have such a divisiveness amongst what, traditional medicine and this like woo woo side,
Mm.
right? And I think it really does women a disservice because it hinders that connection to our bodies. And so, what would you say to someone on social media that is saying, somatic therapy is woo woo, you don't need to like go on an SSRI only and sort of all that jazz?
Well, I think I could best answer this is that I do believe, and one of the foundations of somatic therapy is that we are our greatest healers, that
Hmm.
intrinsically we are able to heal, and that is
Hmm.
supported with somatic therapy. And when we are constantly externalizing everything and trying to constantly consume what this, influencer might say or what this company is convincing me that I need to do in order to heal,
Mhm.
no one's going to tell you what you need if you're not aware and able to look inward. And that's the foundation of therapy, right? It's
Yeah.
Right.
it's taking away all of that external noise
Mhm.
and really diving inward.
Yeah. And there's such an overdependence of consuming this content of like, what
Mhm.
should I do when X? Or how
Uh-huh.
can I heal my nervous system? And it's this oversimplification
Yeah.
that is not conducive to actual healing. I think
Mhm.
the more that
Mhm.
we build up our connection to ourself and our confidence and trust in ourself, the better positioned we are to move into a place of healing rather than looking up how to heal or
Right.
texting ChatGPT.
Right.
Mhm.
It
Yeah.
could be a nice tool in the toolbox, but that
Right.
relational connection reigns supreme.
Yeah,
Yes.
totally.
Absolutely.
We always say it's finding your nuance. No one's
Mhm.
gonna give that to you. No doctor can give that to you. We can get a baseline for health with blood work and all of this, but you are the
Mhm.
only person that can feel what you're feeling.
Yeah.
Yeah.
As I mentioned before, your big emotions, like, we all have
Mhm.
them. Where
Yeah.
are they stored? I love this idea of really diving deep into our bodies. So thank you for explaining all of that. We might have to do a round 2.
Yeah.
But before we go, I wanna do a quick fire round just with some light conversational,
Mhm.
questions. So, what's one wellness trend that you found on social media that you've actually leaned into?
I could say one thing that has been really imperative for me is a place called Restore Hyper Wellness, and I think they have different franchises everywhere. But doing cryotherapy, IV therapy, and infrared
Yeah.
sauna has been a game
Mhm.
changer for me in terms
Mhm.
of detox and healing Hashimoto's. And like with that, like low tox environment, and that's
Mhm.
because we know heavy metals and toxins can really
Mhm.
affect autoimmune. So that's
Yeah,
one I'm definitely leaning into and I support.
I love that. Have you also I think we were talking off camera about this, but have you done any red light therapy?
Oh yeah, that's another big one. That's
Yeah.
I my favorite is infrared sauna, red light therapy, and IV, but that's a day. And that is not something I always have time to do, but
Yeah.
I feel so much better after
Mhm.
because I know I have like a deficiency in minerals, and that's also a big thing
Mhm.
with autoimmune.
Mhm.
So yeah, I love that. Feels
Yeah.
so good.
And mood and anxiety as well.
Absolutely. Yeah.
Yeah. I don't know if this is a wellness trend, but I said not drinking coffee on an empty stomach
Oh
because I
yeah.
see that a lot on
Yeah.
socials. And I'm like, oh, this actually helps if I have something, if I have my breakfast before my coffee. I
Yeah.
feel less anxious.
It's
So
so
what do you have for
hard to do.
breakfast? Yeah.
What I have breakfast, I am a big like yogurt bowl or oatmeal bowl person with
Okay.
like peanut butter and fruit and nuts and all the good stuff.
I gotta do
Ooh.
that. That is one thing
Yeah,
that is
I
so
love
hard for me.
breakfast. I bet it's hard with kids, but I feel like that's like my time. I love that.
Yeah, I
Yeah.
love that.
Do you, do chia pudding at all?
Mm.
I have. It's pretty good.
It's
If
so
you
good.
if you spice but, like, you have to make it good. I feel like you have to add all the good toppings. Like, it doesn't
Mhm.
taste good on its own. You have to add in all the good
Mm.
stuff.
So we found one when we were on vacation actually in August, and this place had one where it was really thick because they used I wasn't looking at the calorie count. I was just like, let's just get it in there, right? Like
As
we
you
need some
shouldn't,
good
yeah.
fat, some
Yeah.
There
protein,
you go.
fiber because no one's talking about fiber. Everyone's talking about protein.
Yeah.
So the chia seed pudding, and it was super thick because it was full fat coconut milk,
Mm.
Mhm.
um, and then maple syrup, a little bit of vanilla,
Yeah.
and then, shake it up, put it in the fridge, wake up, and then on top it was coconut, unsweetened coconut, pistachios, and, like, a
Yum.
Yeah.
drizzle of honey and a little lemon.
Ooh,
Yeah.
It was so good. Yeah,
yum. Gotta get
so
on
check it
that.
out.
Yeah,
Mm.
I love that.
Um, okay, what's your favorite personal care product?
Hmm.
Oh, I know mine. Um, I have these things called yoga therapy balls, and you can get them on Amazon. They're like 2 tennis balls, essentially.
Yeah.
And I use them I use them all the time, but, like, between sessions, I'll put them, like, I'll lean against a wall and put the ball between, like,
Ooh.
my shoulder and the wall, and it's like, it's self-massage essentially, and so
Hmm.
it helps, like, release all the tension that I'm holding on to, and I'm obsessed with them. They're like
Oh, I love that tip.
$19.
Oh,
Order
that
them.
sounds good.
Great.
Yeah.
Love that.
I really am into lymphatic drainage. I love like
Yeah.
compression and I also love dry brushing. And
Hmm.
I don't even know what they're called. What is the gusha
Oh,
things?
gua sha.
Guasha.
Guasha.
Yeah.
Like I definitely do that around my thyroid and my
Hmm.
neck. And it just really tries it. I enjoy it. I think dry brushing can be really helpful for
Yeah.
lymphatic drainage.
That's one other thing that, like, I think PSA to women in general, where it's not just products and brands that are trying to prey on women. It is like full services. Like, there are
Yeah.
brands out there that are building brands around lymphatic drainage, around all these things where they're not actually doing it properly. Like, I
Hmm.
went to a
Mhm.
place where they hurt me and I was trying to ask them to stop. I was actually bleeding
Oh my
Oh
gosh.
my
after.
god.
And I love the Brazilian lymphatic drainage technique. It is
Hmm.
fantastic. I've been seeing my friend Naira for years. And I would just caution women as they're looking for services and like I almost want to call it quick wellness, where you go to a
Mhm.
place and they have
Hmm.
all the tools.
Hmm.
It
Yeah.
sounds like, Catherine, you found an amazing place where they have
Hmm.
offerings that work well for you. But
Hmm.
I would caution women to really do their research, meaning look at what they're offering, speak to people, the relational element to make sure you're
Yeah,
not just going somewhere and wasting your money on something that isn't effective,
definitely.
um, and where they're not actually doing something correctly. Like ancestral healing and all these different modalities that we can learn from other cultures are fucking fantastic.
Hmm.
Yeah,
But when they're commercialized, it loses that luster.
Yeah.
totally. And it's like white women are appropriating all of
Hmm.
these models that have been around for so, so long and
Yeah,
doing them wrong and then not giving credit where credit is due. So,
totally.
100%.
yeah.
Um, Maybe we can link some of our favorites in the show notes so
Oh,
gals
yeah, that'd
can
be
take a
fun.
look.
Sure.
What's the last thing you Googled or chat GPT?
I Googled wedding guest dresses because I feel like I have 10,000,000 weddings in the next month, so
That's
Did you find
fun.
any good ones?
it's just such a rabbit hole. Like, I hate online shopping for that reason,
Mm,
and I feel like I always go on Revolve for wedding guest
Mhm.
dresses, and there's, like, so many that I like, but then you order, like, 10 and only I don't know. It's a whole thing.
Yeah.
yeah. Mm,
There are so many good Australian brands.
I know,
I'll have to
but it's
send you
so
a
hard to
couple.
return
yeah,
Yeah.
and takes a long time to come sometimes, but
Yeah.
I'm
that's true.
open to suggestions.
All right, we'll have to offline about that one.
Yeah.
Catherine, what about you?
The last thing I Googled was this morning because my son asked me how many days until his birthday, and that has been a question that has been asked of me
Mhm.
since January 1st, and we are about 42 days away. And I am very excited for him because he's been waiting a
Oh.
full 365 days.
Oh, I love it. That's so good.
Yeah.
A podcast, a book, or a resource that you'd recommend to women?
I love the podcast We Can Do Hard Things,
Mm,
if you've
hmm.
heard of it.
Yeah,
That's a
it's a
really
good
good
one.
one, and then
Awesome.
the book No Bad Parts is, like, the intro to IFS that is really accessible for everybody.
Yeah.
Cool.
I really love the podcast Therapist Uncensored because there is, it's all about attachment styles, but they really break it down and help you understand that, like, not everyone is in a specific style. You're not trapped in your attachment style. And there are a spectrum within each attachment framework, and you can move through that within
Mhm.
different phases and relationships in your life. And I love the way they explain attachment. It's something I work with intensely in my practice, and I would definitely recommend it.
Awesome. Thank you. This was an amazing conversation. Thank you, gals. Before we
Thank,
Aw.
go, where can people connect with you, learn more about you and your practices?
Yeah, all of my social media is at Emily Powell Authentic Self, and my practice is called Authentic Self Therapy Collective.
my social media is cat.hidalgo therapy, and I am you can find me on Psychology Today. I am in the middle of making my website, so stay tuned for that.
We can't wait.
Mhm.
Well, thank you again. This was such a great conversation. I feel like we can keep talking for hours.
Yeah.
And I can't wait to find my practitioner here in Massachusetts and get going.
Yeah. I'm excited for you.
Well, thanks,
for
guys.
having
Have a
us.
great, yeah, of course. Have a great day.
Thanks.
Bye.
Bye.